Delirium, unraveling the clouded mind. Delirium is a perplexing condition that affects millions of people worldwide. This article aims to shed light on this often misunderstood mental state and provide valuable insights into its causes, symptoms, diagnosis, treatment, and prevention. Understanding delirium. What is delirium? Delirium is a sudden and severe disturbance in mental abilities. It is characterized by a fluctuating course, attention deficits, and disorganized thinking. Individuals with delirium may experience hallucinations and exhibit bizarre behavior. Our course will provide you more information about delirium. Types of delirium. There are two main types of delirium, hyperactive and hypoactive. Hyperactive delirium involves restlessness, agitation, and emotional outbursts, while hypoactive delirium results in drowsiness, slowed movements, and reduced responsiveness. Causes of delirium. Medical conditions. Delirium can be triggered by various medical conditions, such as infections, metabolic imbalances, and neurological disorders. It often occurs as a complication in critical illnesses. Medications and substances. Certain medications, including sedatives and antipsychotics, as well as the abuse of alcohol or drugs, can induce delirium. Recognizing delirium. Common symptoms. Common symptoms include confusion, incoherent speech, disorientation, and changes in perception. Delirious individuals may experience a distorted sense of time and place. Differences between delirium and dementia. It's essential to differentiate between delirium and dementia. While both conditions can lead to cognitive impairment, delirium typically has a sudden onset and is reversible when underlying causes are addressed, unlike dementia. Diagnosis and assessment. Medical evaluation. Diagnosing delirium requires a thorough medical evaluation, including a review of the patient's medical history and a physical examination. Cognitive testing. Cognitive assessments, like the Mini Mental State Examination, MMSE, help gauge the severity of cognitive impairment and track changes over time. Treatment and management. Addressing underlying causes. The primary goal in treating delirium is to address the underlying causes. This may involve discontinuing medications that contribute to delirium or treating infections. Medication and behavioral approaches. In some cases, medication can help manage delirium symptoms. Behavioral approaches, such as reorienting the individual, are also valuable in providing comfort and support. Prevention. Reducing risk factors. Preventing delirium involves minimizing risk factors, such as maintaining good hydration and avoiding unnecessary medications. Hospital delirium prevention. Hospitals employ various strategies to prevent delirium in patients, including maintaining regular sleep patterns and keeping patients mobile. Delirium in special populations. Delirium in the elderly. Elderly individuals are more susceptible to delirium due to age-related changes and the presence of multiple medical conditions. Delirium in children. Delirium can also affect children, especially in the context of severe illness or trauma. Real-life experiences with delirium. Personal stories. Sarah's battle. Sarah W., a 65-year-old retired teacher, experienced delirium during her hospital stay. Her family recounts the confusion and distress she went through before a proper diagnosis and treatment brought her back to her senses. John's journey. John's delirium was a result of medication complications. His wife shares their experience in dealing with the sudden changes in John's behavior and the relief they felt when the delirium was successfully managed. Maria's struggle. Maria's battle with delirium following surgery was a challenging experience for her and her family. They share the difficulties they faced and the importance of a strong support system. Mark's recovery. Mark's journey through delirium was marked by uncertainty, but his resilience and the support of his family and medical team led to a remarkable recovery. His story offers hope to others facing similar challenges. Lisa's triumph. Lisa's experience with delirium, although challenging, ended with a remarkable triumph. Her family shares the strategies they used to help her through this difficult period. Caregiver experiences. A daughter's dilemma. Emily C. cared for her mother, who had delirium during her battle with a severe infection. She describes the emotional toll it took on her family and the importance of a strong support system. A nurse's perspective. Nurse Jane D. shares her experiences in caring for delirious patients in the hospital. She discusses the challenges and rewards of helping patients recover from this condition. Success stories. Recovery and rehabilitation. Michael's miraculous recovery. Michael V., a middle-aged man who developed delirium during a prolonged ICU stay. made a remarkable recovery with proper treatment and rehabilitation. His story inspires others to remain hopeful during challenging times. Emily's return to normalcy. Emily, an elderly woman who experienced delirium after surgery, made a full recovery and resumed her active lifestyle. Her story highlights the importance of timely intervention. Daniel's triumph over delirium. Daniel's journey through delirium was challenging, but with the support of his family and innovative treatment methods, he managed to regain his cognitive abilities and lead a fulfilling life. Tips for caregivers. Communicating effectively. Maintain a calm and reassuring tone when communicating with a delirious individual. Use simple and clear language to convey information and instructions. Offer frequent reassurance and validation of their feelings and experiences. Encourage the person to share their thoughts and concerns. Creating a calming environment. Minimize sensory overload by reducing noise, bright lights, and unnecessary distractions. Maintain a consistent daily routine to provide a sense of security and predictability. Ensure the environment is comfortable and familiar, with personal items and photographs. Promote relaxation techniques, such as soothing music or gentle massage. Dealing with challenging behaviors. Remain patient and avoid confrontations or arguments. Seek professional guidance and support if behaviors become difficult to manage. Consider involving other family members or caregivers to share the responsibilities. Remember to take breaks and care for your own well-being to prevent burnout. Research and innovations. Recent advances in delirium research. Innovative diagnostic tools. New diagnostic tools, such as advanced neuroimaging techniques and biomarker tests, are aiding in more accurate and timely delirium diagnoses. Pharmacological interventions. Ongoing research is exploring the use of innovative medications to manage delirium symptoms with fewer side effects. Preventive strategies. Research is focusing on identifying high-risk populations and implementing preventive strategies to reduce the incidence of delirium, particularly in hospital settings. Behavioral therapy. Innovative behavioral interventions, including tailored cognitive rehabilitation programs, are showing promise in improving cognitive function in delirium patients. Family-centered care models. Research emphasizes the importance of involving families and caregivers in the care process, leading to better outcomes for delirium patients. These recent advancements offer hope for better delirium management and improved patient outcomes. Conclusion. Delirium is a complex condition with various underlying causes. Understanding the symptoms, risk factors, and preventive measures is essential in providing the best care for those affected by this condition. Real-life experiences, success stories, caregiver tips, and the latest research findings further enhance the value of this article, ensuring that it serves as a comprehensive resource for readers facing the challenges of delirium. If you or a loved one is at risk of delirium, take proactive steps to mitigate those risks and ensure a better quality of life. FAQs. Can delirium occur in young, healthy individuals? Yes, delirium can affect individuals of any age, although it's more common in those with underlying health issues. Is delirium always reversible? Delirium is often reversible when its underlying causes are addressed promptly. What is the role of family members in supporting someone with delirium? Family members can provide emotional support, help with reorientation, and communicate with healthcare providers to ensure the best care. Stay informed, seek support, and take proactive steps to address delirium effectively. Our course will provide you more information about delirium. Your health matters for us. Quali.health